grief. And over the course of our nursing lives, we never quit learning. Some things we learn only nurses would understand, and some are universal. I will dispense with a little of what we've learned now. You'll go through at least 4 pairs of shoes a year. A comfortable pair is your most important piece of equipment. That and coffee. And wash your hands. I know that sounds obvious, but it bears repeating. Saying you're a nurse and being a nurse are 2 very different things. Your very first medication will be a dose of reality. Your second will be a dose of humility. You will learn to deal with life and death every day, but you'll be helping families who are dealing with it for the first time. Faith is medicine, as is laughter, as is music, as are dogs. Support hose. You might feel old wearing them, but someday your legs won't look old because you did. There will be days when you cry on your way to work, and there will be days when you cry on your way home. All of those days will pass. You'll either love night shift or you'll hate night shift, and somewhere along the line, you'll probably change your mind. Night shift will eat anything. Manage your time well. It will be the difference between walking what feels like 20 miles and what feels like 50 miles. Wash your hands. Chocolate is therapy. Some events are milestones, like seeing your first baby born, or your first code, or the death of a patient. Nurses train residents. Doctors can't do what they do without you. You can't do what you do without each other. You treat one patient at a time, and you treat them completely and with all your attention, and then you move on. Patients are often in your life for only a short while. You're often in theirs for the rest of it. Almost everybody likes pudding and Jell-O. Drink lots of water. Wash your hands. Celebrate small victories. Put losses behind you. You're never alone. When you feel alone, just reach out. You'll find a nurse standing there. You won't have to watch your back, but you will have to protect it. Nurses find humor in things most people find disgusting. You have to. It keeps you sane. A warm blanket can make all the difference. So can a cool washcloth. You'll learn to appreciate piggybacking IV fluids. When nobody's looking, dance. You will go from saving a life 1 minute to cleaning up an incontinent patient the next. Life is ironic. Patience will teach you more than you teach them. Check, recheck, then recheck again. You'll learn to love sticking people and take pride in being able to establish an IV where others didn't think it possible. There will be a patient now and again who will remind you of why you chose to be a nurse. Embrace those moments. Remember to breathe. In the end, everything you do comes to naught if you don't do one thing. When it's all said and done, you simply have to care.